In 1979, I was diagnosed with a chronic medical condition called hypertrophic cardiomyopathy. The next 38 years were a roller coaster of medical testing, expenses, doctor's visits, fighting to maintain a job that had good health care, or leaving my job to start a nonprofit organization to help others with the disease, but always having to make sure my husband had a job that had good health care. And in 2010, the Affordable Care Act was signed into law. And for the first time in my entire life, I didn't fear my chronic illness because finally my government was protecting me from discrimination and becoming disenfranchised from health care. I don't want to be politically charged here, but there is a fundamental truth that we as Americans need to address, and that is what is right, what is just, and what is fair. I have a child with a diagnosis of hypertrophic cardiomyopathy. I have family members, and I represent a community of thousands of people living with a disease that has no cure, that has expensive drugs, expensive devices, and expensive surgeries as a part of staying alive. I'm not talking about cosmetic surgery. I'm not talking about something that maybe make us feel a little bit better each day or give us energy or help us get an erection. I am talking about implantable defibrillators that shock you back to life after suffering a sudden cardiac arrest. I'm talking about open heart surgery called a myectomy, which allows the blood to flow properly through your heart. I'm talking about heart transplantations when there are no other options left. And that's where I live today. I'm waiting for a heart transplant. I'm 48 years old. I was diagnosed at 12. I have fought my entire life to stay alive. I've had a stroke. I've lost part of my brain. And while I stayed alive, I also stayed gainfully employed. I started an organization that actually employs others. I've helped thousands of people individually and through the organization. And now I find myself in a space where I have to put a video out to plead with my lawmakers, my legislators, my senators, my congressmen, my president, to not make my family face financial disaster by disenfranchising us from access to quality health care. And I'm not talking about just throwing in a health care policy that says, okay, you have health care. I need specialized health care. I need subspecialty care to stay alive. And I need subspecialty care for my community so that they don't waste money having tests that a local doctor thinks they need that doesn't do any good for them anyway. They need to go to the people who actually know how to treat this disease. And you can't do that on bargain basement policies. You need quality coverage so that these amazing men and women who are providing us with healthcare services can actually keep their doors open and pay their expenses, because the imaging equipment we need is complicated and expensive, because the infrastructure of these programs are expensive. Their knowledge, experience, and training are expensive. So I'm asking something of every single person who watches this video. You need to contact your congressman and your senator, and you need to demand that pre-existing medical conditions be legally protected from discrimination and disenfranchisation. What we need is to improve upon the ACA. I'm one of the very strange people who've actually sat and read all 2,200 and some odd pages. That was back in 2009, so I forget the exact number. I know there's a lot of stuff in there that I wasn't quite sure why it ever landed in there, being honest. But there's a lot of substance, and there's a lot of protections for families like mine and yours and millions of others. So what we need to do today is use our voices, calmly, rationally, and specifically reach out to each one of our congressmen, senators, and to the president's office directly and say, I am one of those who would become disenfranchised, and you are threatening my life. I know that sounds dramatic. It is dramatic. They are threatening our lives. I try not to get too emotional, but when you've seen what I've seen, and you've seen people before ACA not able to get to care, languishing at home, becoming more and more disabled until they finally die of disease that didn't have to kill them, then you understand what an amazing thing the ACA did. It brought people to care. It needs work, I'll give you that. But we can't take away the core elements of ACA. We should be building upon them, not tearing them down. And I know this is complicated, and a lot of people just don't like being told what they have to do. But every piece of the ACA was put in place to fortify the step before it. We need to be sure that everybody has health care. We need to be sure that all pre-existing conditions are covered. We need to be sure that our children can stay on our plans until they're fully educated and out on their own where they can get a decent job that will have benefits for them. Because for some strange reason in this country, we have decided that our employers should make the most intimate decisions about our lives and our health. I don't quite understand why we allow that to happen, but that's a fight for another day. We should be able to buy health insurance policies like we buy auto insurance or homeowners or car insurance, and it shouldn't be this big convoluted maze. But there should be standards, and those standards should include that there have to be basic requirements that are covered under a health insurance policy, or it can't be called a health insurance policy. You should be able to go to an emergency room. You should be able to go to a doctor. You should be able to choose your own doctors. Women should be able to choose their OBGYN. Men should be able to choose their own doctors. Gender should not play into choice or rating of a health insurance policy. They get us pregnant, we pay more. No. We all pay the same fair share. We're all part of the human race. These are core elements that must be included in ACA. I've included a letter that outlines the core features. I'm not getting into electronic medical records. I've not discussed those issues, and we as an organization have not discussed those issues because we need to make sure the core is handled. And that core makes us safe. It makes us not afraid of every day. Because right now, 8% of those with hypertrophic cardiomyopathy access healthcare through the ACA. That is 8% of us that are going to lose our healthcare if Congress does not act quickly. 8%. That's a big number. When 1 in 500 plus people have HCM, so it's 1 million people in this country have HCM, and 8% of them are accessing healthcare right now through the ACA. And poof, it's going to be gone. And they're not going to have care. So what's going to happen when they have an arrhythmia and they pass out on the street and they get brought into the emergency room? Who's going to pay for that? You're expecting these families to be able to pay out of pocket $40,000, $50,000. Oh, and Vice President Pence. Health savings accounts only work when you make enough money to actually save money to put into your health savings account. The average member of the Hypertrophic Cardiomyopathy Association has an average income of about $48,000 to $54,000 a year. They are struggling to get by. I don't know what dream world you're living in that we can all of a sudden, poof, just put 50 grand in a savings account and that'll pay our bills. But we're grounded in reality here. They don't have that kind of money. Sorry, your health savings account are not the answer. They might be able to pay for some copays and deductibles throughout the year if somebody can scrounge together a couple $1,000s. But that's not our global answer. Our global answer is quality health insurance at reasonable rates that protect our pre-existing medical conditions and don't charge us out of the market so we cannot afford to be here. We need your help, people. Call your congressmen, call your senators. There's a link below that will help you get access to who your congressmen and senators are. So I thank you very much for listening. And regardless of who you supported in the last election, it doesn't matter anymore. What matters is that our families are protected, and we all need to work together to ensure that these protections are maintained. Thank you.